Can just one pill stop your migraine and get you back on your feet in as little as 2 hours? Let's talk about Nurtec ODT on today's episode of the Headache Channel. Welcome back to the Headache Channel. I'm Dr. Alexander Krob. I'm a full-time board-certified headache medicine doctor, and I've helped thousands of people living with headache live better. On today's episode of the Headache Channel, Rimegepant, or Nurtec ODT, an exciting new acute migraine treatment that can get you back to doing the things you need to be doing with just one pill. Before we go on, please take a second and just scroll down a little bit below this screen. If you see a button that says subscribe, please click it and join over 900 people just like you who have shown their support for the Headache Channel and for people living with headache. Have you tried Nurtec? Let us know your thoughts in the comments section below, and I will respond to every comment that you leave. One last thing. Remember that the Headache Channel is for information and entertainment purposes only. It's not medical advice. If you need medical advice, please see your doctor. So what is Nurtec ODT, or Rimegepant? Nurtec ODT, or Rimegepant, is a new orally dissolving tablet for the acute treatment of migraine with or without aura in adults. It's the second example of a brand new class of drugs for migraine treatment called the Gepants. And that's exciting because for longer than many of us have been alive, people living with migraine have had the same three basic choices for acute migraine treatment. These traditional acute migraine treatments have helped a lot of people over the decades since they were introduced, but they also have a lot of shortcomings. Often, these medicines don't completely get rid of migraine pain. They give people some relief, but they don't give people migraine pain freedom. For a lot of people with migraine, these traditional medicines help the pain of migraine, but they don't help the other disabling symptoms like nausea or sensitivity to light and noise. You may be one of those people who have tried these traditional medicines and they work for a while, but the pain comes back the same day. Or you may have tried one of these traditional treatments and found that the side effects are often worse than just putting up with the migraine. Side effects like chest pressure, or nausea, or sleepiness, or jaw tightness. Lastly, these acute traditional migraine treatments are contraindicated in people who have a history of heart disease or stroke, or who have risk factors for heart disease or stroke. Compare your experience with those traditional acute migraine treatments with what we know about Nurtec ODT. Just one pill of Nurtec ODT 75 milligrams starts working within 60 minutes, and within 2 hours, 60% of people are reporting relief of their migraine pain, and 40% of people say it's worked well enough that they can get back to doing what they need to do. More impressively, 86% of people who took just one Nurtec ODT 75 milligrams needed no migraine rescue treatment for the next 24 hours. How does Nurtec work? CGRP pathways in the brain transmit and amplify migraine pain signals. Nurtec works by blocking CGRP receptors, turning down and turning off the migraine. Nurtec ODT 75 milligrams is for acute treatment of migraine with or without aura in adults. There are 6 groups of people who should not take Nurtec. Pregnant women should not take Nurtec. There were problems when pregnant rats were given very high doses of Rimegepant, the active ingredient in Nurtec. Safety and risks in pregnant human moms is unknown. Women who are breastfeeding should not take Nurtec. Safety and risks in breastfeeding are also unknown. People with severe liver disease and people with end-stage kidney disease or who are on dialysis should also not take Nurtec. Other people who should not take Nurtec include people who are taking medicines that can either significantly increase or decrease the levels of Nurtec in the body. Examples of these medicines are shown here in red, and this is not a complete list. Talk to your doctor or your pharmacist. People taking certain medicines, examples of which are shown here in yellow, should only take one dose of Nurtec ODT 75 milligrams in a 48-hour period. Please note that this list also includes grapefruit juice. Other people who should not take Nurtec ODT include people who are allergic to the active ingredient Rimegepant or to any of the inactive ingredients shown here. I will also point out that Nurtec ODT does contain gelatin. This is sourced from cod, pollock, and haddock, so it's not vegan, and it's also not specifically halal or kosher. Compared to traditional acute migraine treatments, Nurtec has relatively few and relatively mild side effects. In studies of people taking Nurtec for 6 months to a year or longer, the most common side effect was nausea, which happened in about 2% of people. It's important to remember that this is not the only side effect. Also, Nurtec, like any drug, can cause an allergic reaction, and that allergic reaction can include things like a rash, or it can even include things like swelling of the mouth or tongue, or difficulty breathing. You can take Nurtec ODT if you have a stable history of heart attack, TIA, or stroke, or if you have controlled risk factors like high blood pressure. There are also no specific contraindications for people who have migraine with brainstem aura or migraine with motor aura, also known as hemiplegic migraine. With a few exceptions, a dose of Nurtec ODT is one 75 mg tablet, up to once a day, up to 15 days a month. To get Nurtec, you'll need a prescription from your doctor. Your doctor will typically write the prescription with a dispense quantity of 8 and a certain number of refills. Your doctor may also give you a sample pack of Nurtec ODT that looks like this one, and I'll be doing an unboxing video on the next episode of the Headache Channel. And finally, if you have commercial insurance, that's any insurance that's not directly paid for by the federal government, you can get Nurtec ODT 8 pills a month for free by signing up with the Nurtec ODT Patient Savings Program on Nurtec.com or by texting the letters NSAVE to 26789. For the most accurate and up-to-date information on Nurtec ODT, please visit the manufacturer's website at Nurtec.com. Well, that brings us to the end of today's edition of the Headache Channel, where we took a close look at Nurtec ODT, an exciting new acute treatment for migraine with or without aura in adults. Remember to subscribe to the Headache Channel for more great content, including the next video, which is an unboxing of Nurtec ODT. The Headache Channel publishes new episodes the first and third Mondays of every month and special edition episodes whenever it matters most. Until next time, I'm Dr. Alexander Krob. Stay well.